My name is Rhea Wanchoo, and I'm a graduate of the Osborne Park Senior High School Biotechnology program. And today I'm going to be talking about informational disparities in global health. Specifically, analyzing diversity and inclusion practices is something I'm extremely passionate about because this became a glaring issue throughout the COVID-19 pandemic. And I'm specifically going to be looking at this through the lens of Germ Busters, my Gold Award project. And just as context, Gold Award is typically the highest achievement one can earn within the Girl Scouts, kind of analogous to the Eagle Award in Boy Scouts, where girls develop a sustainable project that addresses a real world issue. So as a bit about me, I'm an incoming freshman at Berkeley, where I plan to major in cognitive science with a concentration in cognitive neuroscience. And I'm also extremely passionate about peer mentorship, which led me to start Go-To Support, a platform for high school students to connect, where I've since expanded it to several high schools in the Prince William County area. And I also love writing. Last year, I published an op-ed about STEM education in the Scientific American. And I'm also getting a little bit into water sports, specifically kayaking and water skiing. And I absolutely love G-force roller coasters. So before I dive into the specifics of Germ Busters, I'd like to talk a bit about the COVID-19 data that informed my project. To be honest, Germ Busters wasn't what I initially planned for my Gold Award project, but as you all know, COVID kind of threw a wrench in our plans. But in my case, it ended up working out perfectly. As I was conducting research on coronavirus in early 2020, I came upon this graph from the Virginia Department of Health. And what really caught my eye about it was the spike in pediatric cases, specifically between kids aged 0 to 11 years old, which really seemed to coincide with them starting to return back to school. So now I'd like for you guys to consider some of the following questions. How did you learn about COVID-19? What were some of your fears about it, possibly? And where did you find guidance? Personally, I was really into CNN, especially for the early months of the pandemic. And one of my favorite segments was the Sesame Street Town Hall that was hosted by Dr. Sanjay Gupta and none other than Big Bird, which basically talked to kids about some of their fears and how they could go about protecting themselves and others. And for the Germ Busters project, this was really a light bulb moment for me because it encouraged me to think more about how I could create sustainable resources for young kids to understand everything that was going on. And Germ Busters, the initiative that I designed, included kid-friendly mass activity sheets and posters with an overarching superhero theme. And I designed these by enlisting the help of a team comprised of pediatric psychologists, early childhood educators, and doctors to design materials that would be fun and engaging, really appealing to kids 2 to 6 years old. And one of the key objectives of the Germ Busters project was the playing field in terms of global health communication and materials, specifically through the lenses of equity versus equality and diversity versus inclusion. And one of the ways in which I achieved this was through designing the masks. They were not only specifically sized to fit the young kids, but they also included fun and engaging prints that would make the whole concept of masking much easier to them, since early in the pandemic with this whole drastic shift, they were initially finding it stuffy and the transition was incredibly hard on them. And another way that I incorporated this into my project was by translating the project materials, specifically those of the activity sheets and the posters, into Spanish, incorporating some bilingualism. And this sample from the activity sheet reads, "Debutaje como un receptor de gérmenes," which roughly translates to "draw yourself as a germ buster." And the purpose of this was to ensure that the Germ Buster project materials would really be applicable to a broad array of audiences instead of just native English speakers. And another factor that I incorporated into the design activity sheets and the posters of Germ Busters was communication using psychology, the pre-operational stage of cognitive development proposed by Swiss psychologist Jean Piaget, The preoperational stage typically occurs between the age range of 2 to 6 years old, and it's when children start to develop more of object permanence, developing relationships with symbols and actions. And one of the ways in which I did this was through basing the activity sheets on experiential learning, so that through activities such as matching and singing along, they would be able to register the content of the COVID guidelines and then physically put them into practice through masking up and hand washing. And another theme that really anchored the Germ Busters project that I kind of touched on earlier was this whole superhero effect, right? Because superheroes are figures that kids generally look up to and really want to emulate. And leveraging this in the context of global health communication was so powerful, especially because at the very start, like during the summer of 2020, kids didn't feel like masking up. They were so scared about what might happen to them. They didn't really understand why play dates were no longer feasible, but by basing germ busters that kids themselves could be germ buster superheroes, it really made them feel more empowered and in control of their situation. And that taking these practices such as masking up and getting vaccinated were ways that we could mitigate a lot of the case increases that we were seeing. And lastly, as you guys can see here, there is a sing-along song about COVID guidelines to the tune of Mary Had a Little Lamb. Since often reading through these can be a little bit drab to kids, by creating it to a tune that they're familiar with, it can be a little bit more fun for them. And it's a perfect hand washing song that they can use, which really fits within that time. So it was really, with these project materials, all about being creative and putting myself into the kids' mindset to making sure I was developing materials that they could quite easily resonate with. And to speak a bit to the impact of germ busters, so far over 300 masks, booklets, and posters have been donated. And in terms of the masks, they were hand stitched with fabric from Joanne Fabrics. And by enlisting the help of family and friends who kind of fell between the 2 to 6 year old age group, they wore the mask and kind of gave their feedback. And based on that, I optimized the design and various facets of the project to ensure that it would positively impact my target audience. And through partnership with the Osborne Park Key Club, we were able to facilitate donations at the local, national, and global scales to schools such as the Title I elementary school, Sinclair Elementary, shelters such as the Serve Women's and Children's Center, and social service institutions in Prince William County, where over 200 masks were donated for their foster kids Christmas drive. And as some key takeaways of the project, it was really all about ensuring the diversity and inclusion in global health messaging. If there's really any lesson that COVID taught us, it's that we cannot afford to exclude any pocket of society from the conversation, even if they're as young as 2 to 6 years old. And implementing equity and medical product design really means considering those different demographics when creating products. And a perfect example of that was really designing those kid-sized masks with them, which made them more effective, and the kids were more likely to use them since it was something that they could kind of relate to. And leveraging the use of psychological principles and communication was really the anchor to the activity sheets and the posters, so that the materials can be more engaging and appealing to a broad array of audiences. And as for the future of Germ Busters, as previously mentioned, it is sustained by the Osborne Park High School Key Club drives, where members earn service hours through creating external drop boxes in the community. And if you personally would like to get involved, I've put the Germ Busters link here. And in the Get Involved section, there's lots of information about how you could set up a chapter or donate, contributing in your own way. And to wrap up the presentation, I would love to thank all of my peers at the Johns Hopkins Global Health Leaders Conference for allowing me the opportunity to present a little bit more about Germ Busters. And if you'd like to get in contact, information for Germ Busters, as well as my personal email and LinkedIn information. And I hope you all have a wonderful rest of your day.